Hey everyone, so welcome to part 12 of this anesthesia series. Now we'll be talking about pre-op assessment. So, pre-op drug of choice for reducing anxiety is midazolam. Then drug of choice to reduce secretions is glycopyrrolate. Then pre-op antibiotic is cefazolin basically, and it is given 30 minutes prior to surgery or 1 hour before the incision is given. Now, most commonly injured nerve is ulnar nerve, and most common intra-ophthalmic complication. So, it will be corneal abrasion. Then post-op nausea, vomiting, we use ondansetron. Then post-op vision loss is due to ischemic optic nerve. The most common intra-op anaphylaxis treatment would be antibiotics greater than muscle relaxant, and minimum acceptable HV is 8 mg per deciliter and platelet is 1 lakh. So these are the ranges. And coming to next thing, that is Mendelssohn syndrome. Now, Mendelssohn syndrome is caused by aspirin and pregnancy. Now, nil per oral for heavy meals, then breast milk, semi-solid or light meals or formula, and then clear liquids. So this has to be stopped before 2 hours, heavy before 8 hours, breast milk before 4 hours, and this before 6 hours. Now we use Goldman grading system for pre-operative risk analysis for heart. Then we have few more important points. So what are the drugs that has to be stopped during surgery? So we have ACEs, ARBs, diuretics except thiazide, and we have insulin, oral hypoglycemic drugs. So all this has to be stopped on the morning of surgery day. And coming to OCPs, they have to be stopped within 4 to 6 weeks in order to avoid the risk of DVT otherwise continued. And coming to smoking, it has to be stopped 4 to 6 weeks prior again. And other drugs will be clopidogrel, and we have warfarin, low molecular weight heparin, heparin, then we have lithium, SGLT2. So yeah, so clopidogrel, then we have warfarin, we have low molecular weight heparin, unfractioned heparin, we have lithium, Then we have SGLT2. So this is stopped at 7 days prior. This is stopped at 5 days prior. Then lithium is stopped 48 hours prior. Then this and this, both of them are stopped at 24 hours prior, and this has to be stopped at 4 to 6 hours prior. So this is how it is done. So SGLT2 can cause risk of euglycemic ketoacidosis, and lithium, if not stopped, it might interact with, involve, or disturb the muscle relaxants. However, with short acting agents like mivacurium, we can still continue lithium. So next, coming to ASA classification. So we have category 1, where we have healthy individuals or normal individuals. So they don't have any smoking, or they're very less frequent drinker, and they're healthy. Now coming to second one, where we have mild disease present or comorbidity that is well controlled. So hypertension and diabetes are present but very well controlled, and person might be pregnancy or might be obese, and there might be some lung disease as well. So third category will be severe disease. So we have uncontrolled, poorly controlled comorbidities. Then this person is very obese and reduced ejection fraction, and abuse is seen, and pacemaker is present. This patient is on dialysis and all, and cardiovascular problems are also there. Now fourth, this patient is severe, like threat to life is there. That means MI, CVA, and stent or valve is defective, and sepsis, DIC, and all. So it is basically less than 3 months. In 5, it is basically moribund patients expected to survive only if surgery is done, like ruptured aneurysm, trauma, intracranial bleed, organ dysfunction, and all. Now ASS6 will include brain dead patient, where organs will be removed and are used for the donors. So this is just for organ donors. So this is part 11. Next we'll be starting with part 12. We'll be starting with part 13.